part of, this is Greater St. Mark's testing center for COVID, and this is a part of the CHL Choose Healthy Life grant in collaboration with TM46. So we're just trying to make sure that we can provide access to testing for members of the community as frequently as possible, because it's important that people get tested regardless of whether you have been vaccinated and boosted. You still can contract the virus, you still can be asymptomatic and spread the virus, so it's important to know exactly what your status is in relationship to just working your interactions within the community. So we're trying hard to make sure that we can provide testing on a fairly routine schedule so that the community has access to it, since that's one of the most important things I think we can do in trying to combat the virus at this time.
Now, simplified, this simply means that we're doing something for ourselves, right?
Yes, we are. You are doing both making an effort to keep yourself safe and to keep the community safe. You need to know where you stand. And just because you have been vaccinated, I've been boosted, but I do routinely test to make sure that I have not contracted the virus in the process. And if I have, then I know I need to take certain precautions, and we're providing material and information in relationship to that of what you should do when you do test positive in relationship to the virus.
Do you get a sense that the community appreciate what you guys are doing?
I do. All of the testing and vaccination clinics that we've had a great deal of participation by the community. So I think the community is grateful for it, and we're glad to be out here. It's what we need to do in order to try to take care of ourselves. So we'll be here until we can't be here no more.
Yeah, all right. Now, what is your name, please?
Cynthia Wilson from Westminster Presbyterian Church, and I'm a part of the CHL partnership between 5 churches here in Macon County. That's Greater St. Mark, Mount Olive Missionary Baptist Church, Greater Friendship Missionary Baptist Church, Washington Chapel Methodist Church, and AME, and Westminster Presbyterian, as well as TM46.
This has been a tradition with the Tuskegee community and the Macon County community for years. The first hospital was here for black people in the whole country, Johnny Andrew Hospital, and the first Veterans Hospital for the whole country for black people was here. We had Dr. Kenny, we had the first the first female physician in the state of Alabama was Booker T. Washington. And so this is more of a continuation of what has happened down through history, where when it wasn't provided other places, we did it ourselves. So that's been the story of the community partners, Macon County Community Partners Task Force. It's been the story of Movement 46, and so much more right here in the community. In other words, taking things, in other words, taking it by the harness and trying to see what we can do.
Out here in this cold today.
Well, as you can see, I'm here as part of TM46, and we're working with the task force to do community testing. Of course, you know our healthcare situation in Tuskegee. We don't have a hospital, and we certainly don't have a testing facility where the public can go get a free test. We really need one where you can go any day of the week, because any day of the week you might have symptoms and you might need to know whether you have contracted SARS-CoV-2. So this is our starting point as we work up to getting daily testing. We have community testing clinics whenever possible, because we need to be able to track what's going on in our county. We also do questionnaires with the community to find out how the virus has been spreading in Macon County. So we ask people to fill out an anonymous questionnaire so we can see what's really going on right here at home.
Now, what's your opinion about the public's opinion? Do you get the sense that they appreciate what you guys are doing?
Oh, absolutely, because we are at such a loss here in Tuskegee and Macon County because, like I said, we don't have the healthcare infrastructure that we actually need. So everyone is appreciative when there is something like this that's been made available.
Okay, now thank you. You're walking the walk, getting tested yourself, I see.
Yes, sir.
Why is that?
I owe it to myself and I owe it to my people to be an example of what I preach. And safety in our community, it starts with the pastors and all persons who are in leadership positions. So we have a responsibility, not just for our own health, but for the health of our neighbors and our friends and our parishioners.
And you know, Pastor, it appears to me that this pandemic has caused us to understand the relevancy of doing for ourselves. Do I have that right?
You do. And at one time, we were a very close community. And before things happen as they are today, we need to get back to this. And I think this may be a help to bring us to have a more cohesive community again. We used to be a self-sufficient people, you remember that. So we need to get back to that. And it starts with taking care of our health.
What's your opinion of what this service is to our community?
It's giving people who want an opportunity to assure themselves that they don't have COVID. That's what I'm looking at it as. I'm hoping that my results gonna come back negative and I'll be happy.
Well, I pray that it does.
They're forming the line in their cars so they could stay in their cars. They don't have to get out of their cars. Then we give them this clipboard, and it has their intake form. So this is the information that we need to process the test. And then we have something that they can take home with them if they need more information. It tells them about MaconCares.org, our website. And it has the hotline on it, so if they need more information about COVID, they can call that or go online. And then we have an optional survey here. This is the community survey where we're trying to find out what the virus is doing in Macon County. It also has questions about if you have been tested before today, have you had COVID before? And if you did you have to go to the hospital? Did anybody in your family catch it? And we also have questions if you took the vaccine. What type did you take? Did you take the booster? And if you didn't take it, why didn't you take it? And just a couple other questions about insurance and demographics, and it's anonymous, so we'll be tabulating all that so we have a good picture of what's going on. And we take the survey at every testing clinic, so we've been throughout the county with it. And they fill that out, and then when we get this back, then our nursing team administers the test to them. And the tests are processed at the laboratory at Tuskegee University. This is a home care pamphlet that we also give out at the testing clinics, and it has just different things that you can do at home. So if you have symptoms, if you think you might have COVID, or even if you've been tested and you know you have it, these are things that you can do at home. And even if you haven't been infected, we have ideas on how to protect yourself from getting infected. And these are things everyone's pretty familiar with. You're wearing a mask and washing your hands, keeping your hands sanitized if you're out in the public, and cleaning up highly touched surfaces. If someone is sick, we're wearing gloves. And this one is really important, indoor air quality, to make sure you have proper ventilation in your home, because COVID is an airborne virus, and it can linger in the air. So we want everyone to be aware of how to increase the fresh air in their home. And then if you do catch it, how can you reduce the viral load in your body? So we recommend doing oral, nasal rinses, and focus on building your immune system. This is something that everyone should be doing with or without a pandemic, because there are other viruses to be caught. So we want everyone's immune system to be where it needs to be. And we want them to improve the diet in our county, because we eat a lot of the wrong foods here. So we want people to start eating the right foods, so we don't have so much chronic disease which comes from eating the wrong foods. So if we look at the obesity epidemic, or the heart disease, or the cancers, the diabetes, most of this is related to our diet. So we want everyone to start improving their diet. And then everyone needs to think about what kind of prevention or early home treatment are they going to use. So if you do have symptoms with COVID, SARS-CoV-2, is very important to begin treatment immediately upon having symptoms. That can keep you out of the hospital, but most of us don't know what to do for early home treatment. Then we have things that you want to have in your home, just things you would have to treat any kind of cold, just your comfort measures. And then on the back, things you can do to monitor your health. We recommend everybody have something called a pulse oximeter, which measures your blood oxygen level. So most of this disease can affect your breathing, and that device, the pulse oximeter, can show you if your oxygen levels are dropping and when you're entering an emergency condition. Of course, you want to have a thermometer, and we have a chart here so you can tell the difference between influenza and SARS-CoV-2, because they're very similar. So this chart will show you the differences between the two. And then, of course, we refer everyone to maconcares.org for much more information about SARS-CoV-2. Here, these are the different types of testing for SARS-CoV-2. And what we're doing today is something called a Pcr test, and this detects the virus RNA, so it'll detect little pieces of that. We use a nose or throat swab, and it will let you know if you have an infection right now. So that's one of the tools that's used to diagnose COVID-19. Different tests also include the Antigen Test. This is what is known as the rapid test, and this detects part of the virus, the antigens. It also uses a nose or throat swab, and it will also let you know if you are currently infected. It is not as sensitive as the PCR, so they call the PCR the gold standard just because it is so highly sensitive. But the rapid test will let you know right now if you're able to transmit the virus to someone else, a very active infection. But there's a high false negative rate with this rapid test, so you might actually have an infection, but it might not show up, so it's not as accurate as the PCR test. And then we have an antibody test, and an antibody test is not diagnostic, but it will pick up any antibodies that you have from a previous COVID infection. It uses a blood test rather than a swab, and that's how you could tell if you've had it before, or if you need to find out what your antibody levels are. But it does not give you a diagnosis. It doesn't tell you if you're infectious. But this is something where you can look at the past to see if you had a previous infection. So we share this information
So
too.
only one of those tests are given here today?
Right, we are only doing PCR tests here today.
Thank you, ma'am.
And then what I'm going to do, I'm going to go in just about an inch to an inch and a half. It'll feel weird. It's so straight, okay? So I'm not going to lie to you. But all I'm going to do